Okay, we looked at the x-rays. Now we're going to look at your MRI. So x-rays are done with an x-ray machine, which is radiation. It's not a lot of radiation, but some, whereas an MRI is done with magnets, so there's no radiation. So it's very safe as far as that goes, although people who have metal in their body or shrapnel or pacemakers or stimulators and things like that, sometimes they can undergo MRIs. But you were able to undergo an MRI. And on this particular view here, what we're doing is the knee is kind of facing this way. Okay, it's like you're standing up looking at us. That's your femur, your thigh bone. That's your tibia, your shin bone. Okay, and in between the bones is the meniscus cartilage, and then there's cartilage on the end of the bone. On these particular views here, what they're doing is we're slicing through the knee electronically, kind of like a cold cut slicer, 3 or 4 millimeter slices. Okay, so we're actually starting, this is the back of the knee, back here, and we're going to work our way forward. Okay, so as we come forward, anything that's white is fluid. So we have some fluid in our joints that lubricates them, so that's normal. Although when you get arthritis or you get inflammation, itis means inflammation, arthritis means inflammation of a joint. When you get inflammation, your joint produces more fluid, just like if you get inflammation in your eye and it starts to water. So you probably have a little bit more fluid than normal in there because it's a bit inflamed. On these particular views, what we're looking at is the bone should be black, okay? And this is the inner side, the outer side where you're having your pain. And this is the inner side of the knee. And so you notice the bone is pretty black or dark gray here, but you can see these whiter areas right over here, okay? That's microfracturing, stress or microfracturing. So what happens is, as that cartilage on the end of the bone wears down, there's bone underneath it. So as the cartilage wears down, more and more force gets transmitted to the bone underneath. So this is actually real bone right here. This is a real tibia, shin bone. And bone is hard on the surface, but if you peel that surface off underneath, it looks kind of like coral. It's very porous. So as that cartilage wears down, and as your meniscus cartilage wears down, that shock absorber cartilage, more and more force gets transmitted to the bone underneath, and the bone starts to break down faster and the body can heal itself, and you get these stress fractures. And bone has millions of pressure sensitive nerve fibers in it, so it hurts. That's why most people who have arthritis actually have pain coming from the bone, not from the cartilage, because cartilage doesn't have any nerve fibers in it. So these microfractures here actually are what's giving you probably quite a bit of your pain. The meniscus cartilage is this little black triangular thing, so on the inner side of your knee it looks great, but you don't see much of a black triangle here, right? It's all kind of shredded and stuff. So that's the meniscus tear. And then the gray stuff on the end of the bone is the cartilage, the white on the end of a chicken bone cartilage, and you don't see much there. So that's what the arthritis looks like. And again, when you get that white signal within the black bone, that's the stress or the microfracturing, and that's probably what's giving you most of your pain from arthritis.